Understanding hepatitis B. Hepatitis B is a serious liver infection. It's caused by a virus. This virus, called the hepatitis B virus, can damage your liver. You can get hepatitis B through contact with infected blood or body fluids. This can happen through sharing needles, unprotected sex, or from mother to baby during birth. Most adults recover fully, even if their infection is severe. However, some people develop a long-term infection. This is called chronic hepatitis B. Chronic hepatitis B can lead to liver damage, liver cancer, and even death. The good news is that hepatitis B is preventable. There's a safe and effective vaccine. It provides excellent protection against the virus. If you think you might have been exposed to hepatitis B, talk to your doctor right away. Early detection and treatment are crucial for preventing serious liver problems. The hepatitis B virus is a tiny, infectious agent. It's specifically designed to attack the liver. This virus is sneaky. It invades healthy liver cells and hijacks their machinery. Once inside, it forces the cells to produce more copies of itself. This viral replication leads to inflammation and damage to the liver tissue. The virus is tough. It can survive outside the body for at least 7 days. This means it can still infect someone even if it's not in the body. It's important to remember that the virus is not spread through casual contact. You can't get it from hugging, kissing, sneezing, coughing, or sharing food. Hepatitis B is highly contagious. It spreads through contact with infected blood and body fluids. The most common ways to get hepatitis B are unprotected sex. Having sex with an infected partner without using a condom can transmit the virus. Sharing needles. Using needles contaminated with infected blood, even tiny amounts, is a high-risk activity. This is especially true for people who inject drugs. Mother to child, an infected mother can pass the virus to her baby during childbirth. Contact with infected blood. This includes accidental needle sticks, sharing razors or toothbrushes, and getting tattoos or piercings with unsterilized equipment. It's important to note that hepatitis B is not spread through food or water, breastfeeding, casual contact, or sharing eating utensils. When the liver cries out. Symptoms of hepatitis B. Most people with a new hepatitis B infection, known as acute hepatitis B, don't have any symptoms. They may feel like they have the flu. They might experience fatigue, loss of appetite, nausea, vomiting, abdominal pain, joint pain, dark urine, and jaundice, yellowing of the skin and eyes. However, some people develop a chronic infection. This means the virus stays in their body for a long time. Over time, chronic hepatitis B can lead to serious liver problems. These problems include cirrhosis, scarring of the liver, liver failure, and liver cancer. If you have any of these symptoms, see your doctor right away. Early diagnosis and treatment can help prevent serious complications. Section 5. Unmasking the silent invader. Diagnosing hepatitis B. Diagnosing hepatitis B starts with a medical history and physical exam. Your doctor will ask about your symptoms. They'll also inquire about any potential risk factors for hepatitis B. These include past blood transfusions, intravenous drug use, and sexual history. During the physical exam, your doctor will examine your skin and eyes for signs of jaundice. They'll also feel your abdomen to check for liver enlargement or tenderness. To confirm the diagnosis, your doctor will order blood tests. These tests will look for specific markers of the hepatitis B virus in your blood. Section 6. Deciphering the blood work, understanding hepatitis B tests. Several blood tests can diagnose and monitor hepatitis B infection. These tests look for specific antigens, foreign substances, and antibodies, proteins produced by the immune system associated with the virus. Here are some key tests. Hepatitis B surface antigen, or HBsAg. This antigen is present on the surface of the virus. A positive HBsAg test means you have an active hepatitis B infection. Hepatitis B surface antibody, or anti-HBs. This antibody indicates immunity to hepatitis B, either from past infection or vaccination. Total hepatitis B core antibody, or anti-HBc. This antibody appears during and after infection. It indicates past or current infection. Hepatitis B E antigen, or HBAg. This antigen is a marker of viral replication. It suggests a high level of virus in the blood and a greater risk of transmission. Liver function tests. These tests measure the levels of certain enzymes and proteins in the blood that can indicate liver damage. Your doctor will use the results of these tests to determine if you have hepatitis B, what type of infection you have, and how active the virus is in your body. Section 7. Fighting back treatment options for hepatitis B. Treatment for hepatitis B depends on the type of infection you have, acute or chronic, and the severity of your condition. For acute hepatitis B, most people recover on their own with supportive care. This includes rest, fluids, and a healthy diet. Chronic hepatitis B, however, often requires medical treatment to suppress the virus and prevent liver damage. Treatment options include antiviral medications. These medications work by blocking the virus from replicating. This helps reduce the amount of virus in your body and slow down liver damage. Interferon injections. Interferon is a protein that boosts your immune system's ability to fight the virus. It's usually given as an injection, liver transplant. In severe cases of liver damage or liver cancer, a liver transplant may be necessary. It's important to discuss all treatment options with your doctor to determine the best course of action for your individual needs. Section 8. Supporting your liver diet and lifestyle tips. Whether you have acute or chronic hepatitis B, a healthy lifestyle can help support your liver and overall health. Here are some tips.
Eat a balanced diet. Focus on fruits, vegetables, whole grains, and lean protein. Avoid processed foods, sugary drinks, and saturated and trans fats. Maintain a healthy weight. Losing even a small amount of weight can improve liver health. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Avoid alcohol. Alcohol can damage your liver, especially if you have hepatitis B. Don't share personal items. This includes razors, toothbrushes, and nail clippers.
By adopting these lifestyle changes, you can give your liver the best chance to heal and function properly. Section 9. The Shield of Protection Hepatitis B Vaccination. The hepatitis B vaccine is a safe and effective way to prevent hepatitis B infection. It's usually given as a series of 3 or 4 shots.
The vaccine works by triggering your body to produce antibodies against the virus. These antibodies protect you from getting infected if you're ever exposed to the virus.
The hepatitis B vaccine is recommended for all infants at birth and for all children and adults who have not been vaccinated. Vaccination is the best way to protect yourself and your loved ones from this serious liver infection. Section 10. Preventing the spread, safeguarding yourself and others. In addition to vaccination, there are several things you can do to prevent the spread of hepatitis B.
Practice safe sex. Use condoms every time you have sex. Don't share needles. If you use injection drugs, get help to stop and always use sterile needles. Get tested. If you think you might have been exposed to hepatitis B, get tested right away. Tell your sexual partners. If you have hepatitis B, tell your sexual partner so they can get tested and vaccinated. Clean up blood spills properly. Use gloves and bleach to clean up any blood spills.
By following these simple steps, you can help protect yourself and others from this potentially life-threatening infection. Section 11. Living with hepatitis B. A journey of hope. Living with hepatitis B can be challenging, but it's important to remember that you're not alone. With proper medical care, a healthy lifestyle, and a positive outlook, you can live a long and fulfilling life. Here are some tips for living well with hepatitis B.
See your doctor regularly. Regular checkups and blood tests are essential for monitoring your liver health and making sure your treatment plan is working. Take your medications as prescribed. Don't skip doses or stop taking your medications without talking to your doctor. Join a support group. Connecting with others who understand what you're going through can provide emotional support and practical advice. Stay informed. Learn as much as you can about hepatitis B so you can make informed decisions about your health. Don't be afraid to ask for help. If you're struggling, don't hesitate to reach out to your doctor, a therapist, or a trusted friend or family member.
Remember, a diagnosis of hepatitis B is not a death sentence. With the right care and support, you can live a long and healthy life.